Good morning, everyone. Welcome back to Iowa Live. Lou and Jackie
Good morning.
here. You know, we love visiting with a good friend, Corey DeBerg from Grand JiVante. But we're going to talk about some things this morning with Corey to try to let you know what really has been going on. Because for the past 6 or 7 months, Jackie, we've been hearing a lot of stories surrounding COVID-19, of course.
Absolutely. And Corey, you're on the front lines of taking care of our most vulnerable right now, our elder Iowans. But there's a lot we've learned over, I can't believe we're saying 6-7 months from now of COVID-19 being a part of our lives. So let's talk about it. What are some of the things that you've learned that you're now implementing that is creating a better surrounding and opportunity at Grand JiVante?
Well, first things first, it's hard to believe it's been 7 months already since COVID has hit Iowa and the United States. It's been a long 7 months, but I think any healthcare organization out there has learned quite a bit over these last few months. The first one is infection control. And being involved in healthcare, I think we all want to say that prior to COVID, we were all doing a great job. We were all very aware of what was in our buildings. We were all very diligent, making sure everything was clean. And I think we were. I can say that, every organization was very proactive about that. But when you have a virus like COVID and it can spread very easily, it really does open your eyes to what you can do better and how you can improve upon that. For instance, you think about, what has people touched in the building, the common areas, the countertops, the microwaves in the dining rooms, the chairs, the TV sets. All those things are places people touch that maybe didn't get clean on a regular basis because they're not dirty. They didn't show that they were dirty. But now when you have a very serious virus out there, you do start looking at every part of your building and looking at making sure it's clean as it possibly can to reduce that spread of COVID-19.
Yeah, absolutely. You're already doing a great job. Now you're even making it better, ramping it up again, of making sure that you can do even a better job when it comes to infection control. Let's talk about something else that people are utilizing a lot right now and how it is done through Grand JiVante, and that's telehealth.
And that was one thing I would tell you guys. I've been involved in healthcare for 7 years now, and there's always been a big push to do more telehealth. Mm-hmm. When you're 90 years old, 95 years old in a nursing home, we don't, I think, as providers or people in the public, think about when you're that age, sometimes you just don't want to go to the doctor. It's more comfortable being in the building. It's a hassle to get into a wheelchair, to get into a van, to go to the doctor. It can be a very tiring process. That sometimes maybe isn't always worth it for that patient. And we've been trying to do more telehealth, over those 7 years, but there's never been, reimbursement tied to it from the federal government. So if the clinic, the hospital, or wherever, the pharmacy isn't getting reimbursed from the government for that trip, they have no incentive or motivation to want to do telehealth. Now, since COVID-19, the focus has been keep people out of public areas. That way, we reduce that spread. So telehealth has had to happen, pretty much overnight. And it's kind of interesting to see that we've been, as an industry pushing for this for years, and now it's working and it's working well. Obviously, there's still kinks to work out. There's always that determination of when should a person go to the doctor versus doing telehealth. Like, when does that doctor need to lay eyes on you and see everything? But because of COVID, we have, as an industry, embrace telehealth much more than we have, prior to COVID, which I think benefits the patient more because they can be in their own resident room, they can be on campus and not have to leave if they don't absolutely have to.
Yeah, again, thinking of their concern and safety. Let's continue that conversation with another point of using technology like you're able to with telehealth to connect with family members that maybe don't live close by that are now able to see their loved ones a little more often.
Yeah, this could be more of a positive, from all this because we learn how to visit virtually better than we ever have before.
And that is so true across so many different parts of our lives. But looking at it from a long-term care perspective, if you have, let's say, you have a brother or a sister, and maybe you live in Des Moines and one person lives in Iowa City, the question becomes, where do we put mom? Do we put mom in her hometown where she's living right now? Does she go to Iowa City with one son or daughter? Does she come back to Des Moines with the other person? There's always that, can be that tug of war of where does mom go? Like, what's the best option for mom? And sometimes it's leave mom where she currently is living. If she lives in Ames, she stays in Ames. But then it's hard for the kid sometimes to make that trek up to see mom, to be more involved with her, you know, in a time of the part of her life where she needs more of her kids' involvement. And, you know, from a long-term care standpoint, you know, we've heard those concerns over and over and over for years of, you know, we're happy mom lives at Grand JiVante, but, you know, we live 3 hours away. We just can't interact with mom as much as we want. And we've heard those concerns, but, you know, COVID has definitely elevated that and made us go out and buy, you know, I think 5 different laptops, up our internet capacity to make sure that if you live anywhere in the state or the US, you can still see your mom even though you're not in our building. And that's something I think, you know, like we've heard those concerns for a while, but it's definitely made us reevaluate as an organization. And I think as an industry, how do we keep your loved ones in touch with, you know, with you, even though you can't be in our building? I think that has dramatically improved over the last few months.
Yeah, so virtual activity very strong at Grand JiVante, but also keeping the residents engaged in physical activities. That's something else that you guys are still taking part in, right?
Yep, and that was something I would tell you, you know, like back in March when this all kind of hit, it was, I think every healthcare provider was very shocked and making sure that they were keeping everyone safe and not wanting to promote a lot of activities because they were concerned with, you know, the virus spread. If we get them out of their rooms, that's just an increased risk for us as an organization and also for them. But over the last few months, we've realized, you know, going back to infection control, we can keep everyone safe. We can keep everyone clean. We can keep the building clean, and at the same time promote resident engagement versus them being in their rooms and being bored. And I think a lot of nursing homes are figuring this out too. Of we can still be in a pandemic, but still provide really great patient care. We can still have them highly engaged and doing better in a nursing home in a long-term care setting than they could at their own home, where they're not engaged, where they're not trying new things or doing different things. So yeah, over the last few months, we've really learned of how do we balance those two and keep everyone highly engaged and still live in a very high quality life.
Yeah, one of my favorite things is to look at your social media page because you're always doing some fun activities with your residents and creating a strong bond between you and the staff and the residents there. So much of pivoting and learning, and that's what you have done in this industry, especially at Grand JiVante. Corey, if people want to learn more, if they're making those hard decisions right now of what to do with a loved one in their life, but they are hearing of the positive messages you're providing this morning, where can they go for that next step?
They can always go to our website, which is grandjivante.com, or they can always reach out to us at 641-847-3531 and ask for myself or Shasta as our director of nursing, and we can always give you more information and have that conversation with you.
Corey DeBerg from Grand JiVante, you stay safe, my friend, and please tell everybody there we said hello, and we look forward to talking to you next time.
Will do. Thank you, guys.
Thank you. Great to see you.
Bye-bye.
You as well.
Well, we'll be right back. This is Iowa Live.